You already know sleep is important for your thyroid. How important? It's probably the single best thing that you can do to improve its function right now. But talk is cheap. Actually getting more sleep is the hard part, which is why I'm sharing with you 5 tips that I have shared and used with thousands of thyroid patients to help them get better quality sleep in as little as 1 or 2 nights. Number 1 on that list is to tape your mouth shut. By some reports, this is enough to improve the quality and depth of your sleep by up to 20%. Here's why. When you fall asleep at night, your mouth will naturally open. And this is bad because it causes you from switching to being a nose breather to a mouth breather. This reduces the quality of your sleep, the oxygenation of your tissues, and the humidification of your breathing. In other words, your breathing becomes less efficient. On the other hand, when you tape your mouth shut, you gently force oxygen through your nasal passageways, and this has several benefits. One of those is that it has a calming effect on your parasympathetic nervous system, and this calms both your brain and your body, causing you to relax more deeply. The downstream effect of this is it has a beneficial effect on your cortisol, your energy, and the depth of your sleep. Making this change to my own sleep routine brought my nighttime awakenings down from 3 to 4 to 0 to 1. And as far as sleep treatments go, this one is incredibly cheap. All you need is about a 1/2 inch piece of 3M surgical tape that you can put right in the middle of your mouth. One roll will last you about 6 months, and it only costs about $8 or $9. And by the way, you do not need to tape your entire mouth shut. In fact, don't do this. It may be harmful. Just use a small amount right in the middle, and that's all you need to encourage and train your body to start breathing through your nose and not through your mouth. And by the way, if you have a hard time breathing through your nose or you find it difficult, don't worry, I have some other tips for you because you need to still do this. Number 2, use the 4-7-8 breathing technique. If you are somebody who has trouble falling asleep or waking up and getting back to sleep, this one is for you. The 4-7-8 breathing technique is a super simple technique which allows you to activate alpha waves. What are alpha waves? These are the brain waves that your body starts to create as you relax, and it's considered the first stage of sleep. And using this technique allows you to get into these deeper levels of sleep fast. In fact, just 1 to 2 minutes of this breathing can get you there. Here's how you do it. Inhale for a count of 4, hold your breath for a count of 7, and then exhale for a count of 8. By the way, this counting is not necessarily in seconds. It's just a cadence that you create. If you want to do seconds, you can do that, but I actually do it a little bit faster when I count in my own head. Whatever cadence you decide to use, just make sure that you use it consistently throughout the counting for the 4, the 7, and the 8. I used to spend about 30 to 40 minutes each night laying in bed before I fell asleep. But when I started to use this 4-7-8 breathing technique, I cut that down to about 2 to 3 minutes. And by the way, this 4-7-8 breathing technique should be differentiated from box breathing, which is also beneficial if you have a thyroid problem. 4-7-8 is good for falling asleep and getting back to sleep, and box breathing is good if you have stress and are trying to deal with that. What most people don't get is that how you breathe has a powerful effect on your physiology. Just make sure you are using the right technique for the right problem. Number 3 is a simple one, and that is to change your pillow. The wrong pillow will create a lot of tension in your neck. It will limit blood flow to your thyroid gland and may contribute to problems like numbness or tingling in both of your arms. The right one will do the exact opposite. It will keep your neck aligned, it will keep your airway open, and it will help you sleep more comfortably throughout the night. You can find my recommended pillow in the description below. Number 4 is to wear a nasal strip. Nasal strips work by reducing airflow resistance by up to 30%. This means you get more air with each inhalation through your nose. That air makes its way through your nasal passageways where it gets cleaned and humidified before making its way into your lungs. This path allows you to gain more oxygenation for each breath compared to breathing through your mouth. This allows you to fall asleep faster as your body relaxes and allows you to stay in those deeper levels of sleep longer. If you are someone who isn't accustomed to breathing through your nose, you may find it difficult when you do this at night, but do not let this prevent you from trying. The more you breathe through your nose, the easier it becomes. And if it feels like a struggle, nasal strips are the perfect solution. Taping your mouth will force you to breathe through your nose, and putting the nasal strip on will open up that airway so it's easier. The best part? They are incredibly cheap. One strip will run you about 30 cents each night. Number 5, take sucrosomial magnesium before you go to bed. This is the best form of magnesium if you're trying to relax and you want to improve your thyroid. It also happens to be rapidly absorbed, especially when compared to other forms of magnesium. Here's how to use it. Take 100 to 200 milligrams 20 to 30 minutes before you plan to go to bed. As an added bonus, you can take sucrosomial magnesium along with ozonated magnesium, which allows for easier and better bowel movements when you first wake up. Here's how you can put this routine together. Step 1, take sucrosomial magnesium, 100 to 200 milligrams, 20 to 30 minutes before you plan to go to sleep. Step 2, apply mouth tape and a nasal strip. Step 3, lay your head on your comfortable pillow to allow and facilitate sleep. Step 4, practice 4-7-8 breathing so you can fall asleep quickly. And as a little added bonus, you can also improve your sleep further by taking your thyroid medication right before you go to bed. For most people, this will not keep them up at night and will instead improve the absorption of that medication throughout the entire night as you sleep. The better thyroid function that you have in your body, the better you will sleep. The best part about this routine is that it works for everyone and it works quickly. By using these treatments, you can start to feel better as soon as tomorrow. Whatever you do, don't let thyroid-related insomnia prevent you from feeling your best or prevent you from waking up feeling restored. You can take advantage of all of these treatments at the same time. But if you're someone who gets easily overwhelmed, just start with 1 or 2 of them. Remember, there is a link between thyroid function and the quality of your sleep. If your thyroid is not functioning at 100%, your sleep will suffer. If you need help optimizing your thyroid, then make sure to check out this video next.